Stress and Burnout in Nursing by Christie Polley. Nursing comes with a heavy workload. There's high pressure situations, high emotional demands, and high physical demands that can often cause fatigue, anxiety, reduce productivity, and increase turnover. Stress and burnout affects nurses' health, patient outcomes, and healthcare systems. The purpose of this presentation is to explore causes, who it impacts, and the solutions. Before we move any further into the presentation, let's define stress and define burnout. Stress is defined as a psychological and physical response to anything requiring your attention. Individual response to stress can affect your overall well-being. Burnout is classified as a quote occupational phenomenon and not a medical condition. It's a result from chronic workplace stress that has been improperly managed. Here are some of the causes of stress in nursing. There are many more. Intensely stressful and emotional situations, exposure to human suffering, increased risk for hazardous exposures, a risk for physical injuries while carrying or moving patients, fatigue due to long shifts, and insufficient staffing. Here are some possible causes of burnout in nursing. Long scheduled shifts, poor work environments, including management and coworkers, greater workloads, and repeat exposure to sickness and death. Here are some possible signs and symptoms of stress and burnout. It affects your physical, emotional, and behavioral well-being. Physical signs and symptoms include exhaustion, anxiety, there's a change in sleep habits. Some people get more sleepy, some people stop sleeping very well at all. Frequent illnesses, and change in appetite. Emotional changes include a sense of failure or self-doubt, cynicism, a detachment, lack of motivation, a decrease in career satisfaction. And behavioral signs and symptoms include withdrawn and isolated behaviors, poor judgment calls, procrastination, substance abuse, and skipping work. So what are some of the effects of stress and burnout? Why does it matter? Some of the effects on nurses, most notably, burnout early in a nursing career can lead to long-term cognitive problems, sleep issues, and other chronic health concerns later in life. Specifically on patient care, you can receive inadequate or subpar patient care. There's a depersonalization and a lack of empathy or compassion. There's less staff, means higher patient to nurse ratios, which includes an increased risk for infections for the patients, more medication errors, patient injuries, and much more. Some unsettling statistics. 43% of nurses working in a hospital setting experience symptoms of emotional exhaustion. 50% nurses have considered leaving their profession. And 69% of nurses under the age of 25 experience burnout. We've got to do better. Let's explore some strategies to reduce stress and burnout in nursing. To reduce your stress and risk of burnout, some individual strategies that someone can do, such as develop relationships inside work and outside of work. You can establish boundaries, maintain adequate sleep schedules, exercise and eat healthy on a regular basis. And don't be afraid to reach out for professional help if you need it. Here's a very short list of ideas that an organization can take to help reduce burnout within their nursing staff and to support the staff and specifically the nurses in general. Programs designed to encourage and reward nurses for self care, empowering nurses to have more autonomy, not only in their unit, but in their hospital. Improving technology and minimizing the documentation that they have to do. Introducing mentorship programs such as like nurses supporting other nurses, and enforcing the safe staffing ratios. Nurse burnout is a critical issue that needs to be urgently addressed. Contributing to the burnout is insufficient staffing, emotional strain, and inadequate support. Solutions will require both personal coping strategies and organizational support. It can't be one or the other. Organizations need to prioritize open communication, teamwork, and well being. By doing so, this improves safety, retention, and will ultimately improve on patient care. The future of nursing depends on all of us working together to try to intervene before the stress consumes the individual.